Mr. Speaker, we know that the Recovery Act will save or create 3.5 million jobs across the country, but today I rise to highlight one of many important instances where the American Recovery and Reinvestment Act of 2009 plays a direct and critical role in my own district, the 11th District of Virginia. It's important every so often to take a step back from the macro view and look at the Recovery Act's positive impact on the local economy. I want to point out that the Act's impact on the Greater Prince William County Community Health Center and the thousands of people the center serves in Northern Virginia. This nonprofit facility provides a wide variety of affordable health care services to the uninsured and the underinsured on a sliding fee-based scale, as well as those with health insurance. The health center is the primary caregiver for over 4,000 patients annually, with nearly 32,000 patient visits each year. It provides school physicals, internal and family medicine, physical exams, disease screening, laboratory work, and pharmaceutical assistance. It treats diabetes, hypertension, asthma, respiratory infections, and so many other medical conditions. Without this health center in Prince William County, many of the facility's patients would be forced to use hospital emergency rooms for their primary care, which cost all of us about $6 billion a year, or they receive no care at all. Mr. Speaker, in the weeks before the $1.1 million grant for the Greater Prince William County Community Health Center, which was announced on March 2nd as part of the stimulus funding, the center's management was actually preparing for an orderly and permanent shutdown of this vital facility. The economic crisis, increased demand for health care services, and local funding sources had frankly dried up. Nonetheless, the dedicated staff of healthcare professionals continued to do their jobs and continued to provide quality health care to the center's patients, even though they were not always certain they'd ever receive a paycheck. The health center management desperately sought private and public funding to keep the center going, but the same economic crisis that was driving more patients to the health center was also taking its toll on this nonprofit provider. At a time when the health center was anticipating a doubling of patients in need of its services, the future looked bleak. It's hard to describe the sense of relief I heard when I contacted the center's management to inform them that the Recovery Act had provided a new lease on life. Thanks to this Recovery Act, this outstanding community resource will not become another unfortunate casualty of the recession, but instead will continue to provide much-needed, cost-efficient health care to low and moderate-income individuals and families. And because of this vote of confidence in this investment, they've been able to attract additional investment as well, ensuring their future. I recently toured this Greater Prince William County Community Health Center and had the opportunity to spend time with care providers and several patients. I met with William, a construction worker recently laid off due to the economic downturn. He injured his back on the job, but after being laid off, had no insurance to seek treatment for his constant chronic pain. Thanks to the health center in Prince William County, he was able to see a doctor, received initial care, and was referred to the University of Virginia Medical Center for back surgery. In time, thanks to the center, William will recover. He'll be able to return to work and be a productive and live a productive and hopefully pain-free life. I also met Connie, who told me about her father's debilitating diabetes and how financial constraints placed his life in jeopardy. Connie heard about the center, brought her father there, and today he's on insulin with a much improved quality of life. Thanks to the Recovery and Reinvestment Act, the hardworking staff of the Greater Prince William County Community Health Center will continue to fill a critical need in my district in Virginia. This is only one of thousands of examples around our country of the Recovery Act at work, saving jobs and, frankly, saving lives. Mr. Speaker, the Greater Prince William County Community Health Center is not unique. Throughout America, the Recovery Act is having a positive impact on the lives of millions of Americans. While no one solution will cure the recession overnight, the Recovery and Reinvestment Act is one piece of the mosaic of actions this Congress has undertaken to restore our nation's economic health, protect the well-being of the American people, and make sure that our economy gets moving again. I thank you for the balance of my time.